Hello everyone, it's Dr. Gupta at the Dermatology Laser and Vein Center, and today I wanted to go over the difference between two different types of injectables that are commonly requested in our office, Botox and dermal fillers. And both of these are excellent procedures to help rejuvenate the skin, the face, and help one look younger, but they work completely differently and they are not interchangeable, but they are often done together because they give really beautiful results in combination as well. So what Botox or Xeomin or Dysport or any of these other newer neuromodulators are is that they actually relax muscles of expression. So for example, if you tend to squeeze your brows together a lot and create the 11s, or you're raising your eyebrows a lot and creating horizontal creases in your forehead, getting crow's feet, or you look like you have a downward frown, or your chin is dimpled, or your neck bands are really prominent, then we can use neurotoxins to relax those specific muscles so that there's less movement, and hence the wrinkles that are created by those expressions, by those movements, are then reduced and start to go away. Neurotoxins usually start to work within a day or two. They take about 2 weeks to fully set in, and then they disappear over about 3 to 4 months gradually. But in the process, it does also kind of train you not to make those certain expressions as the muscle memory is reduced from having the neurotoxin, and also the muscle itself starts to atrophy a little bit. So in the future, you may not need it quite as frequently. And if you start early, like a lot of the youngsters are now doing baby Botox, it can also help to ward off those sort of habits that we have in terms of how we move certain parts of our face. And you can modulate that so you don't get the wrinkles later. So the sooner you do the Botox, it's really quite preventive and extremely helpful. Now, fillers are used for volume loss in the face and to fill in wrinkles or scars. So any area that needs volume, we use a dermal filler. The fillers tend to last anywhere from 6 months, even up to 5 years, depending on the kind of filler that we use. And they can be injected also in wrinkles of the forehead, between the brows and crow's feet, and sometimes with Botox, and sometimes you don't really need the filler if you're just getting the Botox. But if the wrinkle is super deep and it's present even when you're not making the expression, then it's a good idea to have a filler, at least initially, to help plump that wrinkle out so that you get a more immediate improvement to that line. And then over time, as the Botox takes over, it is going to prevent reinforcement of that line, and that line will, along with the filler, just work really beautifully together. Fillers are also used for areas of hollowing on the face, so a lot of times in the temples. That's one of my favorite areas to inject if I notice that somebody's starting to lose temple volume, or the lateral face along the jawline. Jawline fillers look absolutely beautiful, can really help give a nice separation between the face and the neck. And then of course the mid-face, we tend to lose cheek fat as we get older, or it sometimes shifts below. And then we can use fillers in the lips, under the eyes, so many places where we can inject it. It also works well for depressions from scars, such as acne scars or other type of scarring. So I hope that was somewhat helpful in understanding what the difference between the two is, and which one you need. We can certainly help you figure that out, and they often do work really well in combination. Any questions at all, please don't hesitate to contact us. Love to answer your questions, and do continue to watch our videos and like and comment on our posts. Thank you so much for watching.